Right, we are now dealing with symptoms, so it's more history stuff. I know that these might be a little bit small for you to see, but I will go through the whole table at the end, and I'll also make the printout available to you. Right, so let's have a look. Retained products of conception. We've got some heavy PV bleeding going on here, maybe with some products also visible. The pathology is in the uterus itself, so the pain is going to be experienced where the uterus is, so suprapubic. It's usually cramping because it's kind of labor pains that are happening to that cause a miscarriage to all the products to come out. However, if this woman is septic, she might also have a discharge, she might have worse and more persistent pain, and she might also have rigors and fevers. Moving now to our ectopic. Ectopics normally, patients with ectopics normally have no bleeding, but they might have a little bit of spotting. They have severe acute unilateral pain. So remember that the pathology is in the tube, so it's going to be very much unilateral. They may have nausea and vomiting from having an acute abdomen, and they may have shoulder tip pain. What is that about? When there's blood that irritates the peritoneal lining, the dermatomes and nerve pathways can get irritated, and the place where the blood pools is connected to where the shoulder tip area is. So that's how that works. That's a terrible explanation, but that's sort of the idea. Okay, our tiger who has got PID grade 3 or 4, which means either she has an abscess, a tubo-ovarian complex, which is why her ovary is bigger than the one on the other side. If we take that away, you can compare. If she's grade 4, then she's going to have generalized peritonitis. So she's going to have severe either uni or bilateral. So you can have bilateral tubo-ovarian complexes, severe pain. She may or may not have seen a vaginal discharge. If there isn't a discharge, it doesn't mean that PID is not on the table. Remember, one of the biggest issues with PID is that it's often a silent infection, which is how it spreads and causes infertility without anybody knowing anything about it. So there may or may not be a discharge. If there is, it's helpful. Also, we're getting to acute abdomen stage here, so nausea and vomiting. And what I forgot to put on this thing, because that's what happens when you have to do things in a hurry, is obviously she is septic, so she might experience fever and rigors as well. Moving on to ovarian torsion. See, there's the ovary that has torted. So that is a blood supply that's being cut off, which means severe, acute. It's really sudden. Pain on one side. It is possible for an ovarian mass to tort and untort. So there's always got to be a mass on the ovary in order for torsion to happen. A normal ovary isn't going to tort. So it can twist, become ischemic, be acutely, severely painful, and then untwist, and then the symptom subsides. If it remains torted for an extended period of time, we're also now dealing with sort of acute abdomen vibes. There might also be nausea and vomiting. So ways to differentiate. These two women we already know are pregnant. This one's definitely bleeding. This one's probably not bleeding. This one's not bleeding. This one's not bleeding. None of them, well, this one may have a discharge, and this one, if she's septic, may have a discharge, but the ectopic and the ovarian torsion will not have a discharge. So these are just some things to help you differentiate between these 4 patients sitting in casualty. And we'll go through each condition on its own right at the end to consolidate everything. Okay, our next stop is going to be at first glance. So you eyeball the patient. What do they look like?